Hi everyone, thank you for your time again. Buki Ademola here with you. In today's lesson, I will be looking at how to approach your OET speaking. How to approach your OET speaking role play. We need to get ourselves prepared physically and mentally to build up the self-confidence that you need. Direct your thought process because winning starts from the mind. Believe you can and you will make it. You don't have to memorize prepared answers, but of course you can use prepared answers, sample answers as a model to guide you in your approach. Of course, in the OET speaking, we often hear of the word interlocutor. Who is the interlocutor? The interlocutor acts as the invigilator to direct and get your speaking test recorded on the tape. Sometimes the interlocutor acts in dual capacity as your invigilator and at the same time as your patient or a carer or as a parent. The beautiful thing is that the interlocutor will not assess your speaking test. There are two assessors that will be looking at the recorded speaking on tape. So the interlocutor will not assess you at that point in time. So that gives you a fair ground that you will not be assessed by the person sitting right in front of you. Now, let's move to the exam scenario. How does it look like? Of course, the interlocutor gives a self-introduction and you will be requested to introduce yourself and provide your means of identification. And this will be followed by the warm-up session. Just as a reminder, you can just check the last lesson. The warm-up session will not form part of your assessment. But why is the warm-up session if it will not form part of your assessment? This is to help you relax, ease the exam tension, and give you the opportunity to get familiarized with the tone and the accent of the interlocutor. What kind of questions can be asked in the warm-up session? Some sample questions can be in this form. Why do you choose nursing? What advice do you have for upcoming generations in your profession? What is the challenging part of your career? These are just some of the questions that could be asked in the warm-up session. The next step is that you will be given the role play card or cue card and a pencil. And this gives you 3 minutes to get yourself prepared. And this is the preparation time. This time is crucial for you to map out the strategy of how you are going to carry out your role play. Of course, the time will not be enough for you to write everything you need to say, but just to strategize how you're going to say it. Remember the clinical communication skills that we talked about the last time. You have to be non-judgmental, empathetic, and listen actively. Now, just to give us a better clue of what the role play preparation time looks like. I have this paper with me just to give you a guide. It says your OET role play card. You have something like that on your cue card. And your profession is highlighted as a nurse. And the next thing, you have the setting. You have to pay special attention to the setting, because the setting dictates how you go about your role play and how you relate with your patient. So the setting could be an emergency department. This is one of them. It could be an outpatient, home visit, hospital ward, or a rehab facility. Then the task. The task tells you what exactly you need to do as regards your role play. The task can be for you to find out something, highlight something, explain a procedure. For example, how to inject an insulin injection. Your task might be in form of compliment. Compliment means to appreciate the effort of your patient, especially when they are doing good as regards their treatment. Oh, great, fantastic. Those are complimentary words we can give to a patient. Or when they give you information that are helpful in planning for their care. Excellent, thanks for letting me know. And lastly, the task could be that you need to check for understanding. This is just to give us an idea of what's the role play card and what you need to do as regards the role play. Now, as regards the introduction, you need to introduce yourself. You need to do your relationship building skill. Good morning. My name is Buki. I am the nurse attending to you in the accident and emergency departments. How do I address you, please? So the setting gives you an idea of how to go about your introduction. If you are having your role play in a ward setting, and how the question is framed might reflect the fact that you are not meeting your patient for the first time. Your greeting and introduction can go in this form. Oh, good morning, Mrs. Betty. We met yesterday, is that right? Oh, yes. Oh, just as a reminder, my name is Buki. I would like to confirm your details again. The most important thing is that you have to do an introduction and you have to acknowledge that you are talking to the right patient. So we must not miss the step. And the next thing you need to do, remember your sense of autonomy as a nurse. You need to seek consent. Your patient must be part of your decision-making process. Your patient has the right to agree with you or to disagree with you. Individual rights must be respected. For example, you can say, go about it in this way. Hello, Mrs. Betty. I would like to ask some questions that will help to understand your condition and how to plan your care appropriately. Is that okay with you? Of course. Oh, yeah, he says, I'm okay. You can go ahead. No, that is gaining the consent of your patient. And the next approach is the implementation of care. The task pay attention to the action on your task card. The action you need to carry out on your task card will dictate what implementation you need to carry out. Either to counsel, either to teach, either to describe a process, you must identify the need of your patient. And as you do that, remember your sense of beneficence to do good to your patient and no harm at all as you go about the implementation. When you have any role play that has to do with pain, anything that has to do with pain, try as much as possible to implement your pain score. Oh, you have a pain on your leg. Oh yes, I'm having too much pain. Oh, on the scale of 1 to 10, 1 being the least pain and 10 being the highest level of pain, how can you rate your pain? No, we should try to apply the model of pain score when we have issues or cases relating to pain. Try as much as possible to make good use of your time. Remember, you have just 5 minutes to do the role play. If possible, use 4 minutes to do the role play and use the remaining 1 minute to sum up, to summarize, get a reflection and go over what you've discussed with your client. For example, you can approach it in this way. Can we just go through what we have discussed? Of course, it is possible that you cannot complete all the action within the 5 minutes, but try as much as possible to cover major parts of the task role. In conclusion, when you are concluding the role play, if your time permits, talk about the next appointment, talk about the next visit. Oh, you need to come again? Or you can give a link up phone directory, or in case you have any problem, you can call this number. Or you give a leaflet just to complement whatever information you have given to your patient. For today, we have to conclude on this note. Hope to see you again. If you like this lesson, just click like and subscribe. Hope to bring more lessons your way. Bye for now.